I'm happy I have a newborn. She is a girl. It's a thing of joy because I had the labor sign yesterday, and in the evening I gave birth. I prefer to give birth at this clinic because of the use of the solar system. Because while I was in the labor room yesterday, there was an interrupted power supply. And after the delivery too, my baby was still under the light, this heat, so that she will look warm.
Nigeria has a huge energy access problem. It's stated that almost half the country is probably off the grid.
We don't usually have constant light. Most times, we're on gen. And if there's no fuel, we have to stay blackout. Blackout all through the night.
Nigerians joke about how generators run the country. Green energy solutions displace a lot of CO2 emissions, protect the environment, and using solar power, beyond that, it's cheaper, it's noiseless, it is safer, it's cleaner, healthier. The Solar Nigeria program is a program funded by the British government that has one sole mandate of propagating solar in Nigeria. And it's basically cut across all of Nigeria, from Lagos to the northern parts of the country in Kaduna, Kano, and now even in the northeast. Locations like the primary health center we find ourselves in now had a lot of challenges, from difficulty in storing medication, blood for patients, challenges in having deliveries at night.
Last one I gave birth, I had a prolonged labor for 4 days. The experience was very, very bitter because when I gave birth and there was no light, they had to call somebody to repair the generator.
You have to go miles to get ice pack or petrol to get put into the generator because of the solar energy now. So everywhere perfect, clean and bright.
The Lagos Solar Project is a combined effort with the Lagos State government. At the time the Lagos Solar Project commenced, a lot of the primary health centers in Lagos State had absolutely no power, especially in rural locations. Solar PV technology has improved. You can now generate much more power for much less the cost. And you also have energy storage solutions also improving in efficiency as well. Ekpe is in a part of Lagos State where there is a whole lot of rainfall. It's close to the sea. So we wanted a situation where if for any reason for 3 straight days we don't have adequate sunlight, the battery bank can actually sustain the entire facility. So running at night is completely seamless. The Ekpe Solar Project has been running continuously, providing 24 hours power supply non-stop from November 2014. This is almost 4 years.
As a pharmacist, solar power is awesome because it guarantees the quality of medicine that we give, the quality of injectables that we give. And you know, our drugs need to be kept under a very optimal temperature because we are concerned about the shelf life of those drugs.
With solar providing consistent energy, the delivery of vaccines across country will drastically improve.
We are sure that our storage system is okay now, and we are sure that the medicines are going to be in perfect condition that when we give them to our patients.
We had an interesting and a very unique situation where the General Hospital in Ekpe actually started bringing their own freezers down to the clinic to store medication. In the past, you had members of public having to go miles out just to carry out laboratory testing. But now all that is carried out within the clinic itself. If we have solar across all the primary health centers, it will greatly improve healthcare in country.
Having power has actually saved lives. Lives, I mean.
When we completed this particular project in Lagos, we started noticing tremendous changes in these facilities where solar was installed. Take, for example, increase in nighttime deliveries started skyrocketing in places like this.
Because of the light now, people have been patronizing the clinic.
Prior to solar installation, the clinic recorded 3 births at night in a month. But immediately we installed solar, that increased to about 30 births in a month with no casualties. So that's a clear indication that infant mortality will drastically drop in different locations, because even the ability to easily see in a delivery room by a medical professional, it will increase maternal delivery and maternal care a lot.
It is between light and medicine.
I will still come back here, and I will still be doing my clinic here for the baby. By next month, so I'm coming here for the immunization.
In locations where we've installed solar power, you start to ask yourself, why have you not gone green all this while?
If every facility across the country is powered, it means that we're going to have a healthcare system that will be unbeatable.